It's Wednesday, July 15th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball. The Honourable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health, are joining via Skype. Please stand by. Our news conference will begin shortly.
Dr. Fitzgerald will be also joining us virtually today. So, as usual, we'll go to Dr. Fitzgerald for her opening comments today.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases in the province, and our total number remains at 262. In total, we have tested 21,134 people. And thanks to our ongoing collective actions and commitment to following the public health measures in place, we continue to do well in keeping the number of new confirmed cases of COVID-19 in our province low. However, as I've said several times before, COVID-19 will be with us for the foreseeable future, and it is unrealistic to think that we will not see more cases of this virus as the pandemic continues. So it's how we respond to these new cases that will determine our success in keeping our numbers low. I know people are scared, but it is impossible to know the personal circumstances of those around us, and people who are unfortunate enough to contract this disease need our support and our understanding, not our judgment and disdain. So as new cases arise, we must treat people with kindness, compassion, and understanding. If people who test positive for COVID-19 feel vilified, others will most certainly feel reluctant to come forward if they have symptoms. And we need to know about cases of this virus in order to prevent future outbreaks. As cases are confirmed, our public health system will be ready to respond in that circumstance. So we all still have a role to play in keeping our COVID-19 under control in our province. So please continue to stay at home if you feel unwell and cover coughs and sneezes. Practice good hand hygiene and maintain a safe physical distance of 2 arms length from others while in the workplace or public spaces, and wear a non-medical mask when that is not possible. These protective measures remain our best defense against this virus. Whether you are staycationing at home this summer or traveling to another Atlantic province, please be respectful of the communities you plan to visit and of local residents, and let the 4 words people, space, time, and place guide you in your travels. We know the greater number of people we interact with, the greater the risk of spread of COVID-19. Physical distancing is pivotal to reducing our risk of contracting the virus, so the more space you have around you, the better. The longer the amount of time spent together, the greater the risk of infection or transmission, and it is less risky to spend time together outdoors than to spend it indoors. As you set out to enjoy your summertime activities at home or afar, please continue to be safe. I know summertime is also a popular time for wedding celebrations and gatherings, and it has not been easy on couples who have spent months planning their special day to have it impacted by COVID-19. I would like to clarify today the rationale for the public health measures in place related to weddings and similar gatherings. We know that early in this pandemic, before restrictions and physical distancing measures were put in place, weddings, funerals, birthday parties, and other such social gatherings accounted for approximately 10% of outbreak clusters. And we continue to see such outbreaks, both in Canada and elsewhere in the world. Unlike restaurants or other physically distant gatherings of people in public spaces, these types of social gatherings are often emotional times involving people who are family and close friends and attendees who may have not have seen each other for a long time. So these circumstances almost certainly increase the automatic response to hug one another, to be close to one another, and have prolonged contact. Weddings are also generally closed events with the same people in the same place for several hours at a time. And we know that the longer people are together in an enclosed space, the higher the risk of transmission. We must also be mindful of our public health and health system capacity when we make decisions such as mass gathering size. We know that rapid contact tracing and quarantine is of paramount importance in controlling an outbreak. If an outbreak were to occur in such gatherings, we need to ensure that our system could respond efficiently and effectively to control it. The larger the size of the gathering, the more difficult this task is. COVID-19 has affected our lives in immeasurable ways, and I certainly understand and appreciate frustration people are feeling by the limitations in place. The decisions we have made have been difficult. Every decision has been made with the health and safety of the population at the forefront and in our own provincial context. Other jurisdictions will have to do the same. The orders may differ among provinces and territories. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 262. We have come a long way in this pandemic, and despite the hardships COVID-19 presents, I know the sense of spirit and compassion for which we are so well known will continue to shine through. We can do this, Newfoundland and Labrador, and we will do it together. Thank you.
Thank you, Dr. Fitzgerald. So again, no new active cases. It's always a pleasant day when we can sit at this table and report that there are no new cases in Newfoundland and Labrador. And as Dr. Fitzgerald had just said, this would not be completely unexpected if from time to time we will have positive cases, recognizing that this virus is still within our communities and lives amongst us. But when you look at other parts of the world and where we are today with no new active cases, we are fortunate to be in this position, but not by chance. We're fortunate that we're here because of the efforts of Newfoundlanders and Labradorians. And once again, I want to thank you for the work that you've been able to do through this pandemic. From day one that we have been advising you to follow the health guidelines, and you have. It's by working together that we will continue to get through this. Our plan in our life with COVID-19 provides us with a guide, and now we continue to learn to live with the virus. So as Dr. Fitzgerald has just said, let's make sure that we keep 6 feet apart, keep physical distance, wash your hands, and wear masks in public areas. And we do hear from time to time of a few individuals who find it difficult wearing a mask for health reasons, but always continue to make sure that you keep yourself safe. So let's always be mindful and respect those around you. Now, during this time of the year, most of us want to get outside and enjoy the bit of summer, even though today is not one of those warm summer days, at least here in St. John's. We encourage you to get outside and stay active. I've noticed over the weekends and on some good days, we see a lot of people out bicycling, do so safely. Also, those Newfoundlanders and Labradorians who appreciate very much to get on the water and take part in the food fishery. We've seen quite a bit of that in recent days. But we must always remember, no matter how simple the tasks, no matter what they are, make sure that we maintain our good health guidelines. Even shopping in some cases can be a little difficult on some people. But always be mindful and remember and respect the personal space of those individuals that you will possibly come in contact with. Now, we have to make sure that we can still have some fun, still enjoy life while staying safe. And by doing this, we'll continue to see the great results as we move Newfoundland and Labrador forward. Now, there's been a lot of discussion in recent days around the opening of the Atlantic bubble. So just want to make a few comments on that. And in the last few days, there have been even more discussion around what would be the potential of opening up even further to the rest of the provinces within Canada. And so I want to take a few minutes just to break it down where we've come within the last even few months in the alert system that we put in place, which I will continue to say is one of the very unique systems that we've had and has become very effective. So as we break this down, the Atlantic bubble opened up on July 3rd. This stemmed from a successful progress that we made, starting with alert level 5, then to alert level 4, moved to alert level 3 on June 8th, and then alert level 2, that was on June to 25th. And then to, of course, the creation of the Atlantic bubble, or the opening of the Atlantic bubble, on July 3rd. So as you can appreciate, the easing of travel within Atlantic Canada has been closely monitored by our public health officials and our Chief Medical Officer of Health. So when it comes down to this old idea or the concept of reopening up to a Canadian bubble, or therefore easing travel restrictions across the country, there's been no firm decision that's been made. So if you're coming into Newfoundland and Labrador outside the Atlantic bubble, you must self-isolate for 14 days. And keep in mind, there's an exemption order that would need to be completed before entering our province. So these restrictions remain in place. July 17th was the earliest date possible, given the science that we've been using. That would have been a 14-day incubation period. So the time between July 3rd and July 17th, this was the 14-day isolation period from the beginning of the Atlantic bubble. That was, as I just said, the earliest possible date to even consider further reopening travel within Canada. Now, same as the decision that we made to ease travel restrictions in Atlantic Canada, any further broader movement to any other Canadian jurisdiction or easing travel restrictions for Newfoundland and Labrador will be determined, guided by our work with our public health officials and the experts that we have, and of course our Chief Medical Officer. This is the science and the evidence base that all of us has made a commitment to from day one. So if we look at the latest travel numbers that we have for Newfoundland and Labrador, it shows just over 99, or almost 10,000, 9,900 travel exemption requests have been approved, and they've been approved within the timeline or time frame of May 4th to July 13th. Now, when you look at the points of entry, and there are quite a few within our province, as an example, a total of 996 people came into our province yesterday. These would have been from all our points of entry. Now, the busiest area for traffic would be the Lab West border, where some 425 of the 996 people that I've just mentioned came through the province. That's about 40 to 50% of the total number of people coming in to Newfoundland and Labrador. And most of these people would be people that are connected to the mines in Lab West, or people in the community of Fairmont moving in or going back and forth to Lab West for services. So it is fair to say that we're not seeing a huge amount of people coming into our province from the other provinces within Canada. Now, not only is Dr. Fitzgerald and our team monitoring the Atlantic bubble, Chief Medical Officers in all jurisdictions across Canada continue to monitor and discuss potential opportunities to move forward in the safest possible manner. So what we have to keep in mind is that decisions relating to travel expansion will be based on where the jurisdictions is and what the reopening plan will be like, what would be like. Our health measures, travel restrictions, and all informed by public health experts and based on science. Now, you may have seen reports just today in the media about a small vessel with 2 foreign nationals that arrived in Makkovik yesterday, arrived there unannounced. Both foreign nationals were arrested and detained by the RCMP and transported back to Happy Valley Goose Bay. Makkovik, the RCMP and Makkovik are now working with the Canada Border Agencies, Services Agency rather, and they will take the lead on this, with the RCMP cooperating and assisting in this investigation. Keeping with travel restrictions in mind, rest assured, if anything is to change with travel restrictions, whether it's the Atlantic bubble or further expansion, we will make sure that you are informed well in advance. And that has been consistent. That's been our approach to the decisions that we have made since all aspects of our public health guidelines since last March. Now, to keep you informed on all things COVID, make sure that you visit the website at gov.nl.ca/COVID-19. So that's where we said so many times you will find all the information about our alert system, about travel exemption forms. We get quite a few calls about people wanting to fill out those travel exemption forms, wanting to come into Newfoundland and Labrador. It's at our website that you'll find that information, as well as the latest information on our health guidelines. There's also information there for businesses. And there's lots of other resources that we have within our province. I just want to remind people of Bridge the Gap. This is an online resource to support mental wellness for both adults and youth within our province. There's also public health materials, which is important for businesses to utilize to help support and educate consumers and employees on the best practices to avoid the spread of COVID-19. So there's a series of posters that you would see. I know for those of you that would have been working or visiting government offices, there's a series of posters that we've been used that we want to share with our businesses. You can print those off our COVID-19 website. If you look at the Business and Employees tab, that's where you'll find this information. But you can also pick them up at no cost at government services centres across the province. Now, speaking of important resources, I want to also remind everyone about a couple of weeks ago that we launched the Domestic Violence Helpline. This was something that I know that many people were asking questions about, as well as something that was a topic of discussion that we had with our Premier's Youth Council. They weighed into this as well and provided some great information on some meetings that I had with them recently. Now, we also recognize that reaching out for help is not always easy. It can be very stressful, and some cases, time and thought goes into this. And that's why we wanted to provide an easy and a safe way to connect you with the services that you need. The Domestic Violence Helpline is a province-wide, toll-free number offered through a partnership between the Government of Newfoundland and Labrador and the Transition House Association of Newfoundland and Labrador. The number is 1-888-709-7090. So this is how it works. If you call that number, the system itself will detect a region where you are located and connect you with one of the 10 transition houses that are part of the Transition House Association of Newfoundland and Labrador. You will then immediately speak with a trained professional who will assist you directly or connect you with the appropriate service or the organization in your community. This could be anything from a women's center to the violence prevention Newfoundland and Labrador organizations who do a tremendous amount of work across our province. Although it could connect you with a government department or an agency, or could even point you in the direction of medical or policing services. The Domestic Violence Helpline is fully text-enabled and provides additional means for those in need to reach out for assistance. The helpline operates 24 hours a day, 7 days a week. So I'd like to, at this point, thank the dedicated and the passionate staff in the province's transitions houses who work every day to help women and children who are facing domestic violence. Your vital work do not go unnoticed. So to those of you who are facing domestic violence in your life, when you're ready, when you're able, please reach out. Call 1-888-709-7090. Now, there's a lot of great work being done to support and guide you through this pandemic. We've come a long way in a short period of time. It's been just really, literally a few months. So let's continue to be responsible, and as we look to take a step forward, we do not want to take a step back. The health guidelines we have put in place, as always, remain our top priority. Your actions today, as Dr. Fitzgerald said, that your actions today determines what the virus looks like tomorrow. So let's continue to socialize and connect with your family and friends, but make sure that we keep safe physical distancing. So before I turn it over to Dr. Hagee today, our Minister, of course, of Health and Community Services, I also want to make mention and pass along my condolences to the family of Dr. Kim Hong, and who has been a radiation oncologist in our province for many years, who retired a few years ago, but made a significant contribution, especially to cancer care in Newfoundland and Labrador. Well known, widely known across our province, and someone who has been the recipient of many awards. So I send out my condolences to the family and friends of Dr. Hong. So at this point, I want to turn it over to the Minister for his comments today.
Thank you very much, Premier, and I'll start where you left off to recognize the work of Dr. Kim Hong. He was one of the pillars of the Bliss Murphy Centre in more ways than one. One of our initial radiation oncologists, played a crucial role in setting up what is now one of the jewels in the healthcare system of Newfoundland and Labrador. He was a nice guy, and he was a good doctor, and he left a hole when he retired, and he'll leave a slightly different hole now he's passed. So, again, my condolences to his family and friends. Well done. Again, we have a straight line, a flat line of no more cases since the guy who returned from working away. And I would just echo what Dr. Fitzgerald has said. We can't vilify people because a virus happens to attack them. This individual had perfectly sound reasons for working away. He had done everything right when he came back, and the system worked. And I think that's a testament to his responsibility and a testament to public health. We have had a good weekend. I'd like to recognize again our colleagues in Service NL and the Newfoundland and Labrador Liquor Corporation for their work they have done in helping the hospitality industry police itself. I would like to recognize Hospitality Newfoundland and Labrador and Mr. Denty, who I've met with on occasion to talk about things from their business world, and recognize that there is a huge body of responsible patrons who have made this last weekend a success and an enjoyable one as well. So again, congratulations to all concerned. And as Dr. Fitzgerald says, when we put our minds to it and work together and pull in the same direction, things go well. Usually, at this point, I would provide some update on regional health authority activities. And they have continued to expand from the point of where we really shut things down for safety's sake during the early days of COVID-19. We are conscious of the backlog and conscious of the weight that people have had to worry their way through over the course of the last little while. So for the province as a whole, for laboratory services, they're back up to 92% of pre-COVID levels. They dipped at 42% in the first 8 weeks of the COVID pandemic. Medical imaging is up to 78% from a trough of 26%. We have cardiac surgery, which has actually now got to 104% of its pre-COVID levels, having been running at 25% for the first 2 months of the pandemic. Endoscopy went down to 12% in the first 2 months and is now back up across the province to 84% of pre-COVID activities. And surgery, from a dip of 22% at the beginning, is now back up to 86%. So from the point of view of facility-based services, we are not far off the 85% target that was set. Those figures relate to the week of July the 6th, so they're very recent and quite topical. In terms of primary care and clinic visits by RHA facilities, we're back up to 63%. But remember, over this period, we still have an 8-fold increase in the number of virtual care appointments compared with the early days of COVID. And that is, I think, a singular success story of the pandemic and its response. So doctors' offices are open. Allied health professionals' offices are open. If you need their services, they are there for you. Again, we are at a situation now where we are living with COVID. We have to bear in mind Dr. Fitzgerald's mantra of people, space, time and place. It's up to each of us to perform a risk assessment on any activity we choose to do or engage in with our loved ones. And that's the way we can judge how safe it might be. The key to preventing the spread of COVID-19 is physical distancing. And on those occasions where you find yourself in a situation where that's not entirely possible or practical, a non-medical mask in your pocket is better on your face than in your pocket. So with that, Premier, I think, again, thanks to all concerned. It's been a good weekend, and I'll turn it back to yourself.
Thank you, Minister. We will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 8 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask the questions in the order they registered for today's call. Our first questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier, I'm wondering if you can give us an indication or a timeline when discussions might begin to happen in terms of a Canadian bubble. When we look at the Atlantic travel bubble, any of the cases that have popped up in this region haven't actually been linked to the Atlantic travel bubble. They've been outside cases outside of Canada, actually. So with that, wondering when discussions may happen, as many have family across the country.
Yeah, you're correct, Kellyanne, and you're absolutely right in the fact that the cases that we would have seen in throughout Atlantic Canada, not many in Newfoundland and Labrador, just the one, but throughout Atlantic Canada over the weekend and the last, week or so. So they have not been associated to the Atlantic bubble. But right now, we're just going to continue to monitor this. As I've mentioned earlier there, July 17th was the earliest possible date. And that was, of course, based on a 14-day incubation period. So I'll be speaking with my colleagues. I spoke to some of them today, and we'll have further discussions of where this is. But important here is that, we're not anxious to get there right now. It's making sure that people are kept safe, making sure that we'll continue to work with our public health officials. No decision would have been made, and if indeed we get to a decision point, that will be given out well in advance so people can make travel plans. But right now, is that I think there's the feedback from a lot of people within our province is that they've enjoyed the safe province that they currently live in. We'll continue to monitor this, use the science and the evidence like we have in the past. Any decision will be made well in advance of giving people time to travel, if indeed we even make a decision to open it up further.
So it sounds like we're backtracking quite a bit here. July 17th was a tentative date, and now we might not even be happening.
No, not backtracking at all. No, that's the wrong word, Kellyanne. Not backtracking at all. There was never backtracking off anything. It was July 17th would be the earliest possible date. We've always said we would monitor during this time frame, and when we felt we could do so in a safe manner, given the epidemiology, always said we would use public health officials. The only reference to July 17th would have been the earliest possible date that we could consider opening up. So we're very consistent with our approach with all of this. So that is where we are today, and we'll speak to our other premiers in Atlantic Canada before any decisions made. But as I said, keeping our province safe is the top priority for us.
Thank you for the clarification. Dr. Fitzgerald, many daycares have been reaching out saying that they're trying to understand the limitations in terms of their grouping, especially when it comes to playing outdoors. We know that that's been encouraged, but right now they're extremely limited. And when we look at the K-12 education plan for reentry, it's encouraging outdoor play. It seems like with normal levels for the most part, but when we look to daycares, it's very limited to 4 to 5 children at a time. Is there going to be any movement with these restrictions?
So what we've said when it comes to daycares is that it should be cohorts of children, and that's something that we're still saying with schools as well. So we're looking to have groups of children who are together for most of the day to continue to play together outside. Whenever you go, if you mix the cohorts and then there happens to be a case, then there's a greater group that you have to do contact tracing with, right? So what we're trying to do is to allow kids to be able to play outdoors, to allow some of that normal activity that's happening within schools and daycares, but to try to keep things as contained as we can to aid in any public health follow-up should that have to happen. So those that same principle of cohorting will happen with schools as well.
Thank you.
Our next questions are from Mark Quinn of CBC News. Please go ahead.
Yes, thank you for this opportunity. I wondered if New Brunswick's been talking about opening up its province to people from parts of Quebec from the Gaspésie. Does that mean that if New Brunswick allows some people from Quebec into their bubble, that we have as well? What's to prevent people from coming through New Brunswick from Quebec to Newfoundland and Labrador?
Well, see, Mark, if you think about what the decision that we made a few weeks ago within the Lab West border with the community of Fermont, which is in Quebec, and with the community of Blanc-Sablon, which is in Quebec as well, so that they can actually move freely amongst those regions. So if you're in Gaspé, it's a similar, I think, connection to, it's the way it's been explained to me. by officials in New Brunswick. That is a similar scenario to what we have within Labrador. Now, in the case of Blanc Blanc coming into Newfoundland and Labrador, they had to come in with a travel exemption, so they just can't come in from Fairmont into the island portion or even other parts of Labrador without a travel exemption. So the same would apply for us, for those residents that would live in the Gaspé region that are moving back and forth to New Brunswick.
My second question is, we've learned that a public lab in this province is doing COVID testing for a private lab, Avalon Laboratories. What would you say to people who are concerned that using a public laboratory to do private work means that people with money have access to COVID testing and others don't have access to?
So I would begin that by saying that, from what I know about the private lab that's operating within our province right now, this in some cases could mean testing for a workforce that will actually go as a safety precaution for someone that would actually travel into a work site, and so people can use that opportunity. The other thing that's important here is where we are with our own use of PPE. They would be responsible for making sure they have that available. So it's not unusual to what you would see with other things that would happen from time to time within our healthcare system. Is not about affordability. If you have the symptoms, you can show up, call 811, and you can get the test done within public health at no cost. What we're talking about here from a private testing company would be typically around those that are connected to a work site, and you could have large numbers of people that as a requirement and a condition of their work they would need to be tested. But this is not an interference, or does not mean that someone can jump the queue here. If anyone's showing symptoms in Newfoundland and Labrador and they want to get tested, well, you can make the appointment with public health officials.
But they are jumping a queue if they don't have symptoms. They can pay, these companies can pay to have, and using a public lab, pay to have these tests done for their employees who are asymptomatic.
Well, so what you're happening there is this is not a part of the test, from a public health point of view. This is a requirement and sometimes a condition for people to go to work. We often see people that would require medicals as an example for their workplace as well, and sometimes that comes with a cost. That's a condition of the workplace, and so right now, if any of those individuals they want to come to a public health lab because they're showing up with symptoms, well, that can be done, and so all they need to do is go through the steps and the processes that are in place. We have tested, we're testing quite a few, and typically it's not unusual to see, well, between 100 and 200 people in our province that are tested for various reasons. We test, as an example, before you go in to get an elective or a procedure done within the hospital right now, and that's for twofold. One, to make sure that the person going in and having that procedure done is not positive for COVID-19, and this would be to protect staff as well as to protect that individual. So there's the scenario that you're talking to and you're comparing about with Avalon, the test there is usually a requirement or a condition of that workplace.
Okay, and do I have a third question?
Yes, you do.
Okay, thank you. We know that many people have expanded their bubbles quite broadly, maybe to the point of bursting. And the two cases I think of in particular are there was the FFAW protest where hundreds of people gathered outside of the building there, and of course the confusion case recently. If I understand correctly, there were no cases of disease that came from those two events. And I think a lot of people are taking from this that there is not a real risk of transmitting the disease within Newfoundland and Labrador. Are they wrong?
So I don't think it would be safe to assume that there's no risk of transmitting the disease in Newfoundland and Labrador. All it takes is for one case to go somewhere and we can have spread of this virus, or you have a couple of people who may be sick who go somewhere. And we do still, even with travel restrictions, and we still have people coming into this province every day who are traveling outside of the Atlantic bubble and outside of the country, who are coming from outside of the country. So it is quite possible that the virus can be transmitted within the province and brought into the province. So I think, we certainly have to behave as if the virus is here and keep ourselves safe. We know that we have a low prevalence at the moment, but that can change fairly quickly.
Our next questions are from Victoria Babcock of the OCM News. Please go ahead.
Hi there. So for September, if students go back to the classroom, if students and staff show symptoms, they must be sent home. How vague can we be with these symptoms? Is it just one symptom? Is it a headache plus a fever? Can you give me some more detail on that?
Yeah, so when you look at any symptoms that are associated with COVID-19 is what we're suggesting, for teachers and for students. If indeed you're showing symptoms of COVID-19, well, the safe thing to do is to stay home. And of course, this is really to protect your fellow students, your fellow teachers in this particular case here, and the people that you work with. I mean, in a lot of cases, kids are on school buses, or they're congregating within the classroom, of course, or teachers will be connecting with each other. So this is the reason why they're encouraging people to stay home. And as part of the safe restart for the Canadian economy, one of the things that we look at there as premiers and as a prime minister in other provinces is what we'd actually do in that situation in providing remuneration and so on. So this is all part of the discussion right now. But for the safe reopening of schools in September, any child that shows up or gets up in the morning showing symptoms, the best thing to do is stay home. Likewise, for the staff of the school showing symptoms, stay home. I guess you could expand that into any workplace, because keeping our general population and our co-workers safe and stopping the spread or slowing the spread of COVID-19 with other communities. If we do so, if people just show up to work with symptoms, well, what will happen is that we will get COVID-19 once again showing up in those workplaces. That's what causes the spread. So the safety measure is, if you're showing symptoms, well, then we encourage you to stay home.
And as the larger groups of students go back to school, will the province amp up the testing? Will testing be available immediately for students, parents, and staff?
Well, testing right now is part of the requirement. I mean, if you're showing symptoms, you want to be tested for COVID-19, there's a process that we currently go through. And you dial the 811, make the appointment. In some cases, we've had community-based drive-through testing sites that were available too. So as we move into the reopening of schools right now, what the testing would look like, these tests are available. And if we find ourselves, unfortunately, in a situation where we're seeing positive cases, well, the RHAs, public health officials, will look at what the best measures would be for people to get tested. But if you're waiting for a test, we're going to encourage people to stay home until you not just get the test done, but of course, get the results of those tests.
And in terms of masks and mask wearing, starting this weekend, Quebec, for example, is making face masks mandatory for public indoor spaces. What about Newfoundland and Labrador? Is there any talks of more regulations to do with masks?
So we've certainly had lots of discussions about masks, and it is a topic that has been discussed quite widely at many tables. Right now, given where we are with regard to our prevalence, we are not mandating masks, but we certainly strongly recommend that people wear them when they are inside enclosed spaces, or even when they're outside if they're not able to physically distance. So I would recommend that people have a mask on them at all times, and if they get in a situation where they're not able to physically distance, that they put the mask on and protect those around you. And if everybody does the same thing, then everybody's protected to some degree. So while not mandatory at the moment, however, should our epidemiology change, should the prevalence change, then that's something certainly that we would have to consider.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. So most of the cases in this province, they stem from permanent residents who have returned from travel or work outside the province. So why are we still keeping out non-permanent residents who could take the exact same safety precautions as anyone else?
Yeah, so Peter, I missed the last half of your question, but I think your opening comment made reference to that most of the cases that we would have seen from people from Newfoundlanders and Labradorians that would have traveled back. Well, if you look at Carl's cluster, that is probably not the case, and that was, of course, the majority of cases that we would have seen in our province. But you're correct in some aspects of it that, you know, people that would have been Newfoundlanders and Labradorians, there's some examples that that we've come up with that has happened, that's the case. So you could see someone who lives in our province, they return to Newfoundland and Labrador, they could, you know, be tested positive with COVID. Well, that's the same thing that we keep discussing as we keep reopening or having discussions about reopening our province is what's happening with the epidemiology within other provinces. How many positive cases are you seeing? Because we know as people move about, if you're moving about from another jurisdiction, well, your level of exposure, if you're passing through one of those pressure points for COVID-19 in our in the country, well, the level of exposure will obviously increase. So that is the reason why we use public health. We just kind of monitor what's happening with other provinces before we open up Newfoundland and Labrador. That's where the exposure is, as you just mentioned. And as you know, most of the large cases and the number of cases that we have in our province have been indeed associated with traveling. You're correct in that assessment.
Okay, I guess what I'm asking then is why are, say, for example, a non-permanent resident, this goes right back to the whole travel ban and the lawsuit and everything else, why are they any more or less of a risk than all these supposedly hundreds of people who are traveling for work or traveling? I don't understand why there's not a consistency between those two policies.
So are you making reference to the Atlantic Canadian aspect of this?
No, I'm referring to people outside the Atlantic bubble, or even before the Atlantic bubble. Just people coming from outside our...
Right. So if you come into... okay, I got you now. So if you come into outside of Atlantic Canada right now, you're required to isolate for 14 days. So this is the, typical incubation period that we've been... that we've been discussing for many months. So if you're coming in from outside of the Atlantic bubble now from another jurisdiction, then you must self-isolate for 14 days. And the reason why around the Atlantic bubble that there's not a requirement to isolate for 14 days is the prevalence rate within the maritime provinces, within Prince Edward Island and in New Brunswick and Nova Scotia. The rates are low, in some cases even lower than where we would be as Newfoundland and Labrador. So it's based on the epidemiology, it's based on the prevalence rate that we're seeing within those jurisdictions. But right now, the guideline is if you're traveling from outside of Atlantic Canada, when you land in Newfoundland and Labrador, you must isolate for 14 days. And as Minister Hagee just mentioned a few minutes ago, referring to the example that we would have had over the weekend, this shows how effective that 14-day isolation would be for those that travel outside of the Atlantic bubble. Same is true for what happened in Nova Scotia and in Prince Edward Island. These people self-isolated immediately, and it really slowed the spread down simply because of they were following the health guidelines.
Okay, I don't want to use up another question. That seems to demonstrate the inconsistency that I was talking about. I don't want to use up another question because I wanted to get around to this one.
Yeah.
And that is that several observers they've been raising questions about the whole idea that singing is a major risk. And there's a lot of people who are very upset about the ban on singing, on choirs and those sorts of things. Can you explain why bars, sports gyms, etc. are okay, but singing in a physically distant setting is not allowed or highly discouraged?
Dr. Fitzgerald, I'm not sure if you want... Yeah, there you go. You'll probably go through the evidence based on this one.
Some of the evidence that's out there right now, certainly the evidence that we have is based on our experience to date, and we have seen significant spread in situations where there has been singing involved. So in church services, in karaoke bars, in situations where there has been singing. We know that people, when they're singing, they're able to spread the aerosols from or droplets from their breathing much further than if they're not singing. This is all really new information, though, and so we are learning as time goes on. There's not a lot of research being done on it. We're taking a precautionary approach when it comes to this because we do know that we, in places where they have physically distanced, they have still had transmission with singing. So it's. I think the best answer is that the science is still evolving on this, and once the science evolves, and if we get better information, if we get more information about this topic, if we find that there are ways that it can be done safely without increasing the risk, I think we'll certainly consider that and have discussions about that. And I know that right now we're in the process of getting some information on just that topic. So we are examining it. We're looking at it closely, and we're trying to find the best, we're not trying to find, but we're going by the best evidence that we have at the moment. But as we've said with this disease from the beginning, if that evidence changes, then we'll change our recommendations too.
Okay, thank you.
Our next questions are from Holly Mackenzie-Suter of the Canadian Press. Please go ahead.
Hello, a question for Dr. Fitzgerald. Canada's Deputy Public Health Chief said yesterday that going to a bar indoors is a high-risk activity and he wouldn't personally go to one. Would you?
I don't know that I would go to a bar, but that's for a whole pile of different reasons. No, I mean, certainly we know that anytime you're in an enclosed space for a long period of time, especially if you're in a space where you may not be physically distancing, we know that that's a high risk. But everybody has to make their own risk assessment when they're doing certain activities, and you have to keep those words in mind: people, space, time, and place, and that is really important for determining your risk. So whether or not I would go to a bar really shouldn't factor into what someone's decision should be. They should be making that decision for themselves based on the risk. And if they get into a situation where it appears that that risk may be higher than what it should be and what they're comfortable with, then they should leave that situation. But it's really important for people to be aware of their risk in any situation and to try to reduce that risk as much as possible.
Thanks. And just going off that, we've seen quite a few examples of, especially now, reopened bars have become kind of a hotspot for COVID-19 clusters, even, dozens of cases in Montreal over the past week. So just wondering if, is it really worth the risk to be reopening the bars after all this progress?
So
well, as we've said many times, this is about learning to live with COVID-19, and we have to find ways to do that safely. So the bar industry itself has to find ways to help that happen. Patrons who go to bars have to find ways to do that safely and to, try to reduce their risk as much as possible. Obviously, if we start to see that there is a concern with a particular establishment, then we'll have to adjust our recommendations or our orders accordingly. I understand after this weekend things seem to go much better, so we will see how things go in the near future.
Thanks. And just one more question on the people removed from Makovic yesterday with that foreign vessel. Would this be the first case of people being transported to an exit point for contravening the travel ban? And I'm wondering if you can say if there were any fines or other charges under the Public Health and Promotion Act.
Too early to tell yet. There's an investigation being done by the Canadian Border Services Agency, and the RCMP are involved as well. So what the consequence, what the fine will be in this particular case, has not been determined yet. I guess we'll wait for the investigation. So would this be the first? Probably the first that I'm only going by memory, but I don't think we've had anybody that would have been, there might have been one other that would have been turned around at an entry point. But, regardless of what it is, I mean, what the number would be it the first, second, or third, whatever, the situation is this, is that the systems in place in Makkovik last night have worked. The RCMP got involved, as they should in this particular case, and they were taken to Happy Valley Goose Bay, where the investigation has been started, and we'll have more information once this investigation is completed.
Holly, for reference, we've had several people who were turned away from various ports of entry in the province under provincial jurisdiction, and the airport in Gander, the ferry, these kind of things. This, my understanding, is federal because it involves international, falls under the Quarantine Act, and jurisdiction lies with the federal government as exercised through the RCMP. So, as the Premier says, we'll wait their investigation, but provincial involvement to date has been limited to FLR maintaining a presence directly and virtually in Makkovik.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hello. This new outbreak in PEI has been linked to a health worker who was tested and worked some shifts, and then was actually found to test positive. What are the measures that we have in place in this province to protect against that happening to another health worker in one of our health facilities?
Yeah, I think we.
Yeah,
I think if I could. Yeah, okay. If I could, I think we need to be very careful in making reference to the local healthcare worker in PEI, and trying to connect that individual to the 8 cases that they would have had there, because that's simply not what happened. What's happened in PEI is been unusual given the circumstances and the history that the PEI has had with the pandemic. There's actually 4 different cases over there in terms of how there was 4 people that were connected to a student. So 4 of the 8 were connected to a student that would have came in into Halifax, got turned away at New Brunswick and PEI, and went back to self-isolate. That turned out to be 3 other people that were tested positive as a result of that. In terms of the locum that you're talking about in PEI, there was maybe 1 or 2 people that would have been connected, including the physician themselves, as well as maybe a patient. But, so just simply to say that this locum is responsible for the 8 cases is simply not what's happened in PEI. And I've been speaking to the Premier as late as this morning on this particular case and exactly what is going on in PEI. So I wouldn't want to get information out there implying that, all those cases are connected to the locum. So in Newfoundland and Labrador, what would happen? There would be, isolation. There would be rules that would be put in place, PPE, of course, and so on. And those rules actually applied in PEI as well. So, Dr. Hagey, Minister Hagey, I'll turn it over to you now, and you can expand on this a little further.
Yes, certainly. Thank you very much, Premier. I mean, I think the key takeaway from this is that anyone, particularly in the healthcare field, the only safe screening test for COVID is 14 days of self-isolation. And that's been our gold standard all along. And I think, that is where we will continue to focus. One of the things we are doing is we have written our special measures orders, or Dr. Fitzgerald has, around the situations as we find them at the time. So some of those that we have are actually quite old and were based on a situation where we may have anticipated too few healthcare providers and too many patients. Currently, that is fortunately not the situation. And in the light of that, we're certainly having a discussion as to whether or not our own recommendations internally need to be tightened up. Certainly with virtual care, there's no impediment to locum starting from self-isolation to provide that care. But for hands-on, I think we really need to make sure we've got our ducks in a row with this, because between this and Campbellton, it is a risk factor.
I want to come back to a question also from Peter related to banning choir in schools. Other provinces, you would assume, are also basing their recommendations on the evidence that's available, haven't banned or haven't postponed choir and band outright for the fall, and they've instead given guidelines for how these things could happen more safely. Why do we deviate on that? Why is our approach different?
Well, I think
we're not deviating necessarily. I think we're we're using, as I said earlier today, we're using the information and we're applying it to our local context. And, so different provinces and territories will differ in the way that they bring out, they allow things to happen or they recommend things to happen. The information is, I know that there are places, other territories that are not recommending it as we are not. So, I think to suggest that it's a deviation is not, there's a difference sometimes, but, that has to do with each jurisdiction looking at their local context and applying the best evidence to their local context.
I guess just to follow up on that, then what's the difference, I guess, in the local context that we would say that we're not going to do it for now here versus another place? Just, I'm sure there's a lot of people who are asking that question, music teachers specifically in this province, as we approach going back to school.
Well, I can only really speak to our context. I don't know the local context in other jurisdictions, but we take into account what we deem the risk to be, and not, there may be, this is new information, it's new, it's a new disease and new science, and so some people view things differently. So we have to remember that, but also we have to look at our capacity as well, and so these things come into account when we're looking at, should an outbreak happen, what is our capacity to be able to work that outbreak and make sure that we do effective contact tracing and quarantine. So all of that is taken into consideration. I can't comment on what other jurisdictions' capacities are. I can't comment on what their local contexts are. All I can really do is look at ours and take that evidence and apply it to us as best we can.
Yeah, and Patrick, I think what you're getting to, we understand, the question, because people, they kind of look for consistency from, in every province. But I mean, I think it's important that the decision making, we must be able to make the decisions that apply to Newfoundland and Labrador in a Newfoundland and Labrador context. As an example, with the opening of long-term care sites and visitation, because I mean, Minister Hagee and Dr. Fitzgerald spoke about this last week. We've opened it up now. That's not to say that every single province will actually do what Newfoundland and Labrador does. In many cases, we've done the same thing with childcare, and in many cases, we have kind of led the country in our approach to, opening up some services, and we probably on the other end have, been a little more restrictive in some others, but it's trying to find that balance of where we are as a province, using the public health information that we have and putting the Newfoundland and Labrador, touch to that, the impact on our province and what we feel is best, working with public health to protect Newfoundlanders and Labradorians. It's like the size of gatherings. We've had, we were at 50 long before, some other provinces were. So the decisions there have been based on the science and the evidence, and that doesn't necessarily mean they're going to be consistent, with every other province across the country. But I really do understand, why people, I guess, in some cases would like to see that consistency applied, to all sectors. But I think we must remain have the choice of making decisions that apply to our province based on the impact on our residents.
Our next questions are from Callum Smith of Global News. Please go ahead.
Thank you. My questions are for the Premier. Premier, I know you mentioned no firm decision has been made on expanding the Atlantic bubble to include the rest of Canada, and that public health would have important input in that discussion. But just to clarify, what are your thoughts on the idea of a Canadian bubble, the pros and cons, and can you offer a timeline as to when you would like to see a Canadian bubble in effect?
Yeah, so the question about what would be how the decision would work, I guess my own personal thoughts on all of this. I mean, I've listened to many tourism operators and many people that are and how their business has been impacted by the tourism industry within Newfoundland and Labrador. I've also heard from many families that have had, family members that are interested in coming back to our province that live in places like Alberta, Saskatchewan, or in Ontario, people that would want to come home and visit. I've also heard from many people who are saying that, we were just enjoying our own province this year, so we would prefer to keep it that way. We make the decision based on the evidence, working with public health, And we've been using that teamwork approach that we have in our province. It's been very effective for Newfoundland and Labrador, and we'll continue to make sure we add that autonomy to make that decision for our province and our residents. Trying to find a balance to open up our businesses, open up those services that people also want to enjoy within our province, but also not, preventing a risk that could lead to a further outbreak and therefore could mean to closure of some of the services and businesses that we've worked so hard to get open. Our alert system, going from alert level 5 to alert level 2 where we are today, has been working for us, communicating with Newfoundlanders and Labradorians following those guidelines. As I talk with my colleagues in the maritime provinces, many of them, and most of them, I would say, if not all of them, are in the same spot that I am in, is that we must continue to make sure we keep our residents safe. When we make a decision, it will be working with public health, following the evidence and the science that will lead us.
And as mentioned, the New Brunswick government has indicated it's open to potentially trying to expand the Atlantic bubble to include part of the Gaspésie region of Quebec, and I believe you compared that to an agreement your province has. Does that mean you're okay if New Brunswick expands the Atlantic bubble, and more generally, how would that move impact the Atlantic bubble from your perspective?
No, it doesn't necessarily mean that we would be okay with that, and I think the decision-making from a premier in another province and working with, whatever system they would use to make their decisions. I know we work very closely with all the maritime provinces here in Newfoundland and Labrador, and the last time we spoke, which was late last week, we were pretty much aligned on where we see the future of this, even if we can get to a further expansion. Not saying we are, because there's no decision made with this. So we'll use the decision-making mechanism that has worked for us to get us safely where we are today, and that is working with our own officials. And of course, if we get to a point we can see an agreement on this, then we will explore that option. But, for us, it will be our decision here in Newfoundland and Labrador based on the safety of our residents and what's a priority for us, and working very closely with public health officials. We take nothing for granted in this pandemic of where we are, and what we're trying to prevent is actually a setback which would actually be very costly to the economy, to the overall economy of our province, but also, could have a tremendous impact on the confidence. All of this is balanced with the fact we know some families would like to be reunited sometime this year. As we get there, we'll make sure that we can do it safely based on the response that would be required if indeed we do get the odd positive case of COVID. So it's a decision-making tool that has worked for us to get us where we are today. That's the one that we will keep intact and make the decision to the benefit of Newfoundland and Labrador.
I think I understand that you're saying that, again, moving forward, it's again going to be further consultation with public health. But again, just to generally clarify, are you in favor of the idea at some point, whether it's today, whether it's 2 weeks from now, 3 weeks from now, are you okay with the overall idea of a Canadian bubble? And just lastly, as part of my third question, I guess, the Atlantic bubble, how has that impacted your province?
Yeah, so first and foremost, we know that we can't stay closed forever. We know that we have to live with COVID within our province and within this country. But we also see reports that come out of other jurisdictions. It's one of the reasons why we see our U.S. International border still closed and extend it to be closed. So we look at prevalence, we look at what's happening in other jurisdictions, and as we, in Newfoundland and Labrador, as the premier of our province right now, working with our public health officials, that's how we will make that decision, and we will do it when we know it's safe to do so, and we can respond if indeed we had to respond to cases. So we're not there yet, and as I said in the past and many times, if we are to move, we'll make sure that everybody gets lots of an opportunity to actually plan their visit to Newfoundland and Labrador. This is a difficult time for us in our province. Typically we're a province that's known for its hospitality, known for its friendliness. We want to welcome people to Newfoundland and Labrador. It's just that we're not in a position to be able to do that safely at this particular point in time. Hopefully we can get there. What that date will look like, I can't say that today. But we'll continue to work to reopening our province with the services within Newfoundland and Labrador before we open it a little more broadly.
Our final questions today are from Adam Uris of New Brunswick's Telegraph-Journal. Please go ahead. have Adam on the line. Well, folks, the time for questions has ended, and we invite you to join us again on July 22nd at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.